Hi friends, welcome to my channel and this MCQs video. So today we will be discussing a set of 10 MCQs in addition to the previous ones. So stay with me. Thank you. Our first MCQ of the day is the primary circulating estrogen in the blood of pre-menopausal women is, the options are given: estradiol, estrone, estriol, ethinyl estradiol, or any of the above. So in this question we are asked about the predominant circulating estrogen in the blood of the pre-menopausal woman. That is the woman in whom the menopause has not happened yet. She is actually in her young age. So the predominant estrogen in such ladies will be, the correct option here is estradiol. So this is the correct option, and estradiol is the predominant estrogen in premenopausal women. Now the second MCQ, the longest part of the large intestine is, so options are given: ascending colon, transverse colon, descending colon, sigmoid colon, and anal canal. Now if you know about the lengths of these parts of large intestine, you will come to know that the correct option in these is transverse colon. Transverse colon is the longest part of the large intestine. Now moving on to the third MCQ, the primary circulating estrogen in the blood of post-menopausal women. That is women in whom menopause have happened. Menopause meaning that menstrual cycles no more happen in such ladies, and so they are very difficult to get pregnant. In these post-menopausal women, the primary circulating estrogen is, so options are given again: estradiol, estrone, estriol, ethinyl estradiol, or any of the above. Now the correct option in this is estrone. Estrone is the primary circulating estrogen in the blood of post-menopausal women. Now moving on to the fourth MCQ of this video, extended release preparations are abbreviated as, options are ER, XR, XL, SR, or any of the above. Actually, extended release preparations are long-acting preparations. They will not release their active moieties immediately in the body. Rather, they will release their active ingredient over a longer duration of time. And we know that these preparations, that is extended release preparations, are abbreviated as ER, meaning extended release, also as XR, the same as extended release, XL, also the same extended release, and SR, sustained release. So the correct option in this MCQ is any of the above. We can denote extended release preps through any of these abbreviations. So you will observe any of these abbreviations on the cartons of branded medicines. So now the fifth MCQ, the predominant circulating estrogen in the blood of a pregnant woman. Again, options are there: estradiol, estrone, estriol, ethinyl estradiol, or any of the above. Now we know that the predominant circulating estrogen in the blood of a pregnant woman is estriol. So the correct option is estriol. Now the sixth MCQ, which of the following route of administration is usually used for diagnostic and desensitization purposes? Now options are there again: intravenous, intra-arterial, subcutaneous, intradermal, or intramuscular. Now the correct option in this is intradermal. So this is actually the route that is used mostly for diagnostic and desensitization purposes. The other routes are not very feasible for this purpose, as once the drug is injected via these routes, so it will be very much difficult to reverse the drug administration. So that's why this route, that is intradermal route, is used for the diagnostic and desensitization purposes. Thank you. Now the seventh MCQ. The rectal administration of drugs reduces their first pass effect by 30%, 40%, 50%, 60%, or 70%. Now we know, actually we know that the rectal administration of drugs, actually this route reduces the first pass effect of drugs by 50%. So if we give a drug by oral route of administration and its first pass effect is 100%, let's suppose, yes, so the same drug, if we administer that via a rectal route, then its first pass effect will be only 50%. So this is actually the advantage of this route. Yes. Now the eighth MCQ. All but one of the following can be used as routes of drug administration in the unconscious patients. Actually, in this MCQ, we are asked whether the below given routes of administration can be used in the unconscious patients. So options are intravenous, intramuscular, subcutaneous, rectal, none of the above. Now we know that intravenous route can be used in the unconscious patient. Also the intramuscular route can be used, also the subcutaneous route, and definitely the rectal route can be used in the unconscious patients. So the correct option is E, because all these routes can be used in the unconscious patients for drug delivery. Now the ninth MCQ of this video. The absorption of drug does not take place through one of the following routes of administration. Absorption does not take place. Now we have the transdermal patch option, topicals, intravenous, sublingual, inhalational. So we know that absorption takes place via a transdermal patch, also via topical route, also via the sublingual route, and also through the inhalational route. But via intravenous route, absorption does not take place because the drug is actually delivered into the blood directly. So the absorption process will not occur. Actually, absorption process occurs only when the drug is delivered not directly into the blood but around the blood. So it will go from that area into the blood via absorption process. So now we know that the correct option in this MCQ is C. Now the last MCQ. The rate of absorption of drug depends upon the nature of drug diluents in the case of the following routes of administration. This is again actually the previous type of MCQ. Now In this question we are asked the rate of absorption of drug depends upon the nature of drug diluents in the case of the following routes of administration. So options are intravenous, intramuscular, subcutaneous, both B and C, or all of the above. So actually the rate of absorption will depend upon the nature of drug diluents in case of intramuscular and subcutaneous route, because in these routes of administration the absorption will occur, while through intravenous route there will be no absorption. So the correct option in this MCQ is D. That is, both B and C are correct. So this was all for now. Thanks for watching, friends, and please subscribe to my channel if you want to get notified for more upcoming such videos. So thank you for watching once again. Thank you.